Oh, I feel awful this morning. I think I'm gonna go to the doctor.
Oh, sorry, hon, but we can't afford that right now.
But I can barely breathe.
Well, I'm sure it's nothing a little menthol rub can't fix. Oh,
This video is getting real already.
and I was thinking, I think we might have to cancel the kiddos' gymnastics classes. I mean, a sprained ankle just isn't in the budget. If that conversation seems equally messed up and real, you're not alone. In a recent poll, a quarter of American adults delayed medical care in the last 12 months because of the cost. That's a statistic that would make anyone feel ill.
We are living in a strange time of incredible medical advancement and monstrous amounts of medical debt. How did it get this way? And what can you do to keep it from putting your finances in the emergency room?
Obviously, people have been getting sick for ever. But prior to us gaining awareness of all things microscopic, physical ailments were seen as products of mystifying phenomena like supernatural consequences to behavior, and healthcare was more of a spiritual undertaking. Because of this, healthcare services were typically sponsored by wealthy patrons and religious communities as a form of charity. Here's a direct quote of the financial policy written in 1284 by the hospital complex of Al-Mansur Qarawun in Cairo, a sophisticated medical complex of its time. The hospital shall keep all patients until they are completely recovered. All costs are to be borne by the hospital, whether the people come from afar or near, whether they are residents or foreigners, strong or weak, low or high, rich or poor, employed or unemployed. There are no conditions of consideration and payment. None is objected to or even indirectly hinted at for non-payment. The entire service is through the magnificence of God, the generous one.
Wow, that's a pretty great philosophy that they have there around medical care. That's almost 1,000 years old. So, arguable whether or not we have progressed too much in that sense, but curious what else they'll share here.
Wow. Imagine the Hippocratic Oath of do no harm extending to the financial wing of the hospital. But to be fair, medical care wasn't nearly as effective as it is now, and over the centuries, healthcare costs became more and more an individual responsibility. The modern American situation of medical innovation and out-of-reach costs really started in the 1920s. Expensive innovations like x-rays, sophisticated surgery, and anesthesia were becoming commonplace, and the associated costs were outpacing the normal person's budget.
At the time, the Committee on the Cost of Medical Care worked for 5 years to come up with a plan to make things cheaper. Their solution? Hospitals and practitioners should work in teams and be paid either by private insurance or compulsory plans paid through taxes. But this plan was branded as Soviet and essentially shelved. After World War II, the US really started to move in a different trajectory than other industrialized nations. Wage freezes induced employers to start offering health benefits as a way to attract employees. Almost 90 years later, we are still used to obtaining health benefits directly from our employer, not the government.
Decade after decade has seen the American system try to address the issue of ballooning costs with very limited success. In 2019, the American Journal of Public Health did a study showing that 66.5% of personal bankruptcy filings were mainly due to medical expenses.
Wow, that's quite the percentage here. So I'm just going to move myself for a moment. That is 66.5% of personal bankruptcies are from medical expenses. That's a crazy amount. That 2/3 of all bankruptcies happen from medical expenses. That seems like such an obvious issue. I've never heard this stat before, so that's quite surprising to me. In that we've done so little since 2019 when apparently this was determined. So definitely enjoying the information that they have shared here today. Looking forward to what else they have.
I know our international viewers are now laughing in their respective countries because the idea that an illness could result in financial ruin is almost unheard of in the rest of the world. The reasons why we are such an outlier here are complicated, but in general, other wealthy countries have tended towards tax-funded, nearly universal coverage that people don't have the option to opt out of. This is typically known as a single-payer system, like in Norway, Japan, the UK, Denmark, and the UAE, just to name a few. To be clear, these systems have their own issues, but putting patients into dire financial straits just isn't one of them.
And even in countries with similar private insurance networks, there are big differences. First off, you have government-mandated controls on the price of things like premiums and pharmaceuticals. Plus, insurers tend to pay the same costs for the same healthcare services, regardless of location. In contrast, the American system, with the exceptions of Medicare and Medicaid, relies on voluntary private engagement, sans intense price controls. There's also a splitting of responsibility and jurisdiction between the federal government and state governments. This leaves us with an unwieldy patchwork of coverage and pricing, inevitably leading to headaches for our citizens and fuller pockets for the insurance companies sitting in the middle.
In 2010, the Affordable Care Act actually introduced a profit margin cap mandating that insurance companies spend 80% of every dollar on care and 20% on administrative costs. But they didn't limit overall profit levels, so they've essentially been incentivized to increase costs. In 2022 alone, America's largest private health insurance providers raked in a staggering $41 billion in profits. And so what happens when someone needs high-priced medical care and insurance won't pay for it? Debt.
The amount of medical debt carried by Americans is actually hard to nail down. For example, someone could take on credit card debt because of a medical emergency or a trip to Hawaii. A credit report doesn't make that distinction clear, but it's at least $220 billion in the most recent numbers. At least with other expensive purchases like a car or house, you can decide ahead of time for what you're looking for and set your budget parameters. There are also standardized debt products like an auto loan, a mortgage, or a student loan. You can also somewhat easily shop around and compare before you take one out. But when you're a
Yeah, this is definitely a big issue with medical expenses in general, which is you don't really have price transparency when you go to the hospital. So you don't know whether what you're asking for is going to cost $100 or $1,000 or $10,000. And they don't really tell you either. And so most of the time you don't know this until like after everything's settled. And I think that's a very valid point as to why this is so unfortunate. And I think the credit card portion also is big here, which is a good portion of people I know who are in trouble with financial issues and they have a medical expense, they'll standardly go to a credit card. And again, it makes it even harder to figure out what the exact number is here because once it's on a credit card, it's commingled with other purchases. That's definitely a tough situation to be in, to like last minute try to find some way to pay for your medical expenses that you didn't even know how expensive they were going to be until the bill arrived.
appendix decides to blow up, there's no standard regulated form of debt that you can reach for or time to shop around.
Even though you have limited control over getting into this type of debt, a late payment on a medical collection can tank your score just like it would with any other debt. In 2022, the main three credit bureaus decided to drop evidence of paid collections, stop reporting medical debts under $500, and increase the time a medical collection shows up on your report from 180 days to a year. But most people with medical debt owe over $1,000, so big whoop. The CFPB says about 15 million people still have medical debt reflected on their credit. Obviously, this is a systemic issue, but what can you do as an individual about it?
First off, let's talk prevention. Get the best health insurance you can afford, even if you're healthy, and familiarize yourself with their coverage limits beforehand. You can also research which hospitals and urgent cares closest to you accept your insurance. Put those addresses and contact information in your phone ahead of time, should you need them. Once you are
So they already quickly covered a couple good points. So one, I think this is similar to like home insurance or renter's insurance or car insurance that you are likely familiar with already, which is where I think it's very easy for all of us to default to what is the cheapest monthly bill for these insurance plans, because obviously all of us expect and hope that we are not actually going to need these things in the future. And so our expectation is that it will never be used, and so therefore the amount of money that we're spending is basically going to be wasted as part of this work and this policy. And so this is one of the things that can cause problems later down the road, which is usually those plans have the highest premiums or copays. And so again, for like a house or for a car, usually this is like if an incident occurs and you need to pay out, how much do you have to spend? So sometimes you can have a low monthly bill, but then a high payment that you need to add in addition. So maybe they'll expect you to pay a few $1,000s when an issue comes up, but then maybe you're only spending like $100 a month or something like that. And then maybe you could spend $200 a month for a similar plan, but then only spend like $6,000 when an issue comes up, for instance. Obviously, you'd have to look into the details of the specifics of the plan that you're looking at, but generally that's the trend that happens, which is the higher your standard payment is, the lower you spend at the time of using your insurance. And so that's definitely something that they already highlighted, and I would encourage folks to consider, especially because you should think about how much of a safety net you have, and this is usually done in how much savings you have. So these things can be correlated. So right now we haven't used too many numbers, but like let's say you have $1,000 in your bank account and you're going to get your policy. Obviously it's going to be tough to not choose the like $100 option versus the $200 option, but you should check what the premiums are in addition to how much you actually have to fork out when it comes time to use the insurance. So if you go for the $100 premium, but then it's $10,000 when you need to use it, and you only have $1,000 in your bank account, then obviously you know that's going to be a problem once that happens, because they're going to expect you to use up to $10,000 of your own money before the insurance kicks in. And that's going to be a problem for you. Obviously, if you try to get something that has a low copayment here, like $1,000 or less, obviously your monthly payment is going to be higher. But this is a way you can kind of figure out how much trouble you could be in, is based off of how much do you have saved compared to what you actually have to pay out during your policy. And so that's something that I would definitely encourage folks to be thinking about ahead of time.
Most care ask for an itemized list of charges. Medical billing mistakes are rampant. Some studies show anywhere from 50 to 80% of bills have errors on them. In this instance, don't trust. Always verify.
Secondly, if you do end up with a larger medical bill, engage with it immediately and be ready to negotiate. Ideally, you're doing this directly with the hospital or provider beforehand for a non-urgent need, but it can also happen post-procedure. Selling an unpaid bill to a collections agency is a headache for them, so they want to get around that too. Credit bureaus have...
Another thing that I think they quickly covered previously as part of that segment on what to do before, they highlighted having contact information for hospitals around you. Another thing I would encourage is, again, going back into your actual insurance policy. Usually they have like a table or a view in which you can see how much it's going to cost for different types of procedures. And one that I think is probably especially important that we likely aren't checking on a regular basis is how much would it cost to go into like the emergency room versus going into like an urgent care or something like that. And so going into like urgent care by default instead of like an emergency room, in many cases could save you money and be a much smaller charge for you with your current insurance plan. So that's something else that I would recommend folks to understand is like, what are the various options? And if you are financially driven in this decision and you have the luxury to do so because you are not in an actual emergency, then I would likely encourage you to start looking from what the cheapest medical option is, like if that's just going to your primary care physician and booking an appointment in a day or two versus trying to go to urgent care for something that you need to get resolved pretty quickly. And then obviously, if worse comes to worse, then obviously still go to an emergency room. But knowing where the different charges are and then maybe seeing what your options are and going from cheapest to most expensive can also save you a lot of money when you're in one of these scenarios. And so it's better to have this information before that situation occurs, because obviously if you're having some type of medical emergency or medical concern, you're not going to go look up your insurance policy and figure out what you're supposed to do. So have that plan ahead of time, especially if you have a family or other loved ones that are around. And if you have different insurance plans from like yourself versus others that you're taking care of, it's likely useful for you to review those for your personal use and also for the care of the ones that you are in charge of as well.
Also extended the time it takes for a medical collection to show up to a full year. So you have got some time to negotiate with them directly too. But don't let that tempt you into just forgetting about it. The worst thing you can do is ignore the bill entirely.
Third, know your rights. There are laws in place like the No Surprises Act. If you are uninsured, you have the right to an estimate of costs beforehand. And if the final bill comes out to more, you could possibly contest it. And even those with insurance need to watch out. If you go to a hospital that is in network, there might be individual providers within it that are considered out of network. No joke. Thankfully, there are newer laws aiming to fix these types of situations, but every state is different. So this is where you have to do some research and see what is and isn't allowed.
Finally, almost every hospital provides some form of charity assistance. There are also nonprofit organizations that help match patients up with support, as well as medical advocate associations for certain illnesses or disabilities. And whatever you do, try to keep medical debt and consumer debt separate. Converting a medical debt into a personal loan or credit card makes it far more likely that it will end up hurting your finances.
And this
They highlighted this before, and while they haven't mentioned this specifically, I found the example that they mentioned of asking for the estimate and then being able to contest it. That was pretty good advice. Also double checking the receipt, also very good advice. They highlighted the fact that the medical debt doesn't get onto your record for like a year or so. I have actually seen some individuals who are tight on money actually try negotiating with the individual who has the bill and basically trying to make payments over time. In many cases, like they had highlighted, they'd rather get this settled without having to like get other parties involved. And so if you can discuss with them and say, hey, this is a pretty expensive bill, can I make payments over the next 6 months or in 12 months in 1 month increments and solve it that way? I just don't have the money at this point in time. I've heard of people being able to do this directly with them instead of taking on like credit card debt, because again, credit card debt is pretty bad. I think there are interest rates up to like 20 or even 30% sometimes. And that is really going to kill your finances. If you can just get some handshake deal with the individual and make a payment over a few months, that could really help you, where obviously that would likely be zero interest over that time if you can get that negotiated. So that'd be another technique that I would recommend folks using if they're ever in this scenario.
system isn't just broken financially. It would be one thing if these awful costs led to the healthiest citizenry in the world. But our life expectancy and rates of infant mortality, unmanaged asthma, and diabetes are atrocious.
Not many people are happy with the current system, but the silver lining is that it is mostly the result of governmental policy, or lack thereof.
Which means, at least theoretically, that citizens of a democracy have a say in how it's organized. It's one of the many ways in which participating in electoral politics can impact your pocketbook.
And that's our 2 cents.
Before you go, we want to hear your feedback. Every year, PBS Digital Studios sends out an audience survey, which we use to help understand what you enjoy on YouTube and what you want more of.
You also get to vote on new show ideas, so it'd be great if 2 Cents fans were well represented in the polls. There is a link in the description. Thanks in advance.
Thanks to our patrons for keeping 2 Cents financially healthy. Click the link in the description to become a 2 Cents patron.
Thank you for watching. If you enjoyed what you saw, please hit like or subscribe. I'll see you around.